Okay, this is the multi-segmental flexion test. It's one of the SFMA top tier tests or selective functional movement assessment top tier test. What we're doing here, feet are together. We usually go shoes off for this, but essentially all we're doing from this position is a toe touch. So we want to see, can we go down and touch your toes? Now from the side angle, we also want to see same thing. Can we go down and touch your toes? What we're looking for in this test is that as you do that, we get a posterior shift of the pelvis. The pelvis actually moves backwards. Some folks, you'll see as you do this, everything stays forward. This hip pelvis can't move backwards. It's a normal process or position or motion that should happen as we go through multi-segmental flexion. Now, we're not just testing what's happening here at the hips, and we're certainly not just testing the hamstring extensibility. We also see a lot of happening at the spine. So we want to know, can you create flexion through the different segments of the spine to get down there to touch your toes, to use a little bit of everything? Now myself, I have a bit of an extra kyphosis or rounding through that mid and upper back, a little bit that I like to use to get into multi-segmental flexion, to get into deep flexion, and limited through the lumbar spine. And that's a problem with a lot of folks. And then what happens is that becomes a chronic issue. So if you can't utilize the low back to create flexion and round and just be able to move it into this position when you want to, when you're not under load, well, now this becomes a big problem because we lose proprioception and ability to get in flexion, and the brain can start to interpret that as pain or discomfort. So it's not a major cause of pain or injury, but it is a player in this chronic pain in that low back. And we can't, and the brain hasn't experienced flexion through that low back again. So we can check and see, is there a flat spot in that lumbar spine and then rounding beyond that? Or does the lumbar spine low back actually participate, creating one smooth curve of flexion as you go down? You can think from the pelvis into the low back, into the thoracic spine and cervical spine. It's a nice uniform curve is what we want to look for in this multi-segmental flexion. Multi-segmental because we're not just looking at the hips, we're not just looking at one position. We want to know, can the hips play along with the hamstring length, with the segments of the spine to create that position and get down there. Give it a shot.